Welcome to IAG Health. Today we're going to be discussing the Ultrio membership powered by Zion HealthShare. Now, the Ultrio membership includes a healthcare solution with some key benefits. Firstly, IUAs for every budget. An IUA works similarly to a deductible, and it stands for Initial Unshareable Amount. There are no network restrictions with this membership, meaning you can go see whichever doctor or provider you wish. And lastly, there are no annual or lifetime sharing maximums. Now let's discuss some of the services offered on this healthcare solution. First, telemedicine, an absolutely essential key feature, means unlimited 24/7, 365 virtual doctor's visits at no cost. And remember, 70% of the time, a telemedicine visit will end there and not need a follow-up visit. So 7 out of 10 times, maybe something that you would have had to have gone in for previously. If you have this telemedicine feature, you paid nothing. You were handled and taken care of over the phone by a doctor, and it didn't cost you anything. Next is the prescription. There are low copays for tier 1, 2, and 3 medications. You'll see $5, $10, and $40. Additionally, if medications are more expensive than that, you do get a benefit credit of $150 per month, which can be applied toward medications. Next down there is the diabetic testing supplies as well as the insulin program. A little bit on these is that you have a $24.99 free shipping package that includes all of the following: a glucose meter with the first order, 2 50-count bottles of test strips, a lancing device, a bottle of control solution, and a 100-count box of 30-gram lancets. And by the way, you get free shipping. Also, this program offers insulin at a one flat rate, one-stop shop. No matter which brand you prefer, you don't have to shop around for insulin anymore. This offers it at a one flat rate. How convenient is that? Back up to services here. The next one on the list is advocacy. And advocacy simply means you're going to get top-rated, top-notch customer service help when it comes to things like finding reasonably priced providers in your area, paying your bills, navigating the services on your membership. Next section is the preventative shareable services. Now keep in mind there are 3 options of Ultrio membership: 5,000, Ultrio option 2,500, and Ultrio option 1,000. Now those numbers relate to IUAs. And I told you I was going to discuss a little bit more about the IUA. So let's do that now. An IUA is an initial unshareable amount. And whichever one you choose, the higher the IUA, the lower the monthly contribution rate, essentially the lower the price. Middle of the road, and the highest price monthly is the lowest IUA. Now, a little bit more on an IUA. Here we read that all qualified medical expenses submitted after the IUA is met and within 6 months of service are shareable within the Zion HealthShare community at 100%. There's no annual or lifetime limit. So, example, think about, God forbid, being in a car accident where you're hospitalized for a week. Well, if you're on the 1,000 Ultrio membership, what that means is you're going to pay $1,000 of those bills that you're going to receive, and there's going to be a lot of them. After that, everything becomes shareable 100% within the Zion HealthShare community. Now, you will not need to pay an IUA again for the same condition until you're symptom-free for 12 months. So let's say there's complications after 3 or 4 months, you think you're in the clear, and complications come up, and you have to go back in and are treated. Well, guess what? You don't have to meet a new IUA for that because you haven't been symptom-free for 12 months yet. In my mind, IUAs are better than deductibles in a lot of ways. But again, you can see the similarities. It simply is the amount that you pay for medical services before the plan begins paying or sharing costs in this case. Additionally, you will not be responsible for more than 3 IUAs in a rolling 12-month period, and that goes if you're a single individual on the plan or if you are a family of 12 on the plan. Husband, wife, and 10 kids. Still, a household maximum of 3 IUAs in a rolling 12-month period apply. Additionally, an IUA is incident specific. It is not person specific. So many times deductibles are person specific. This is separate and different from that. This is incident specific. So one family member, again, God forbid this ever happened to you or your family, but one person in the family could meet 3 IUAs in that 12-month period of time by themselves. And now the fourth IUA, whether it was that same family member or anybody else in the family, the fourth IUA, essentially there's no IUA. Everything is shareable 100% from the beginning for that incident. Now, if it's an incident that costs more than $500, that is, everything is shareable 100% without the need to meet a fourth IUA. Okay, I spent some time on that because that's the most important part of the plan, because the IUA essentially applies to anything. Just about, okay? Just about. Now, with the preventive shareable services, these are things that don't apply to the IUA, which is why I wanted to discuss that first. These items, you don't have to meet an IUA. An annual provider visit, guess what? Shareable 100% up to $175 without the need to meet an IUA. Now, after 6 months of continuous membership, things like colonoscopies, mammograms, well child visits, and youth immunizations are shareable 100%, up to maximums of $5,000 for colonoscopy, $600 for mammogram, and there's no cap or limit on the well child visits as recommended by doctors. You know, you have a new baby, you have a schedule of well child visits. Those are all shareable 100% after 6 months of continuous membership on the plan. Same with immunizations. There's a whole list of immunizations that are recommended. Those are shareable 100% after 6 months of continuous membership. So that is the preventative sharing services that don't apply to the IUA. So moving on, here are some things that work a little bit differently. So again, in a simple scenario like, God forbid, a car accident, very straightforward. You have hospitalization related to this accident. Then you meet your IUA, everything's shareable 100%. These additional shareable services they work slightly different. And you can read through here. Now that you understand how an IUA works, you'll easily understand what each statement means on this list. So for example, an ambulance visit is shareable when it's related to a shareable illness or injury, right? So again, my car accident example, by the way, your ambulance transport will be shareable in that event because that person, you know, in my example, was admitted to the hospital. They were there for a week. They had loads of medical bills related to that injury, well, including their ambulance is shareable, okay? So all of these items have some uniqueness to them, but now that you understand how an IUA works, you'll understand each of these items. We discussed IUAs. The next thing we need to discuss is the pre-membership medical condition phase-in period. This simply means that if you had been diagnosed or received examination, medication, had symptoms, or treatment within 24 months prior to the effective date of membership, which means within the last 2 years prior to the effective date of membership, this phase-in period applies. The first year, waiting period for all pre-membership medical conditions. It's not shareable. Year 2, up to $25,000. Year 3, up to $50,000. And year 4 and beyond, up to $125,000 of sharing for a condition that existed prior to the Ultrio membership. Amaze is another service provided on this membership, including virtual urgent care, chronic medical condition management, even basic mental health services, health and wellness support, including nutrition and weight loss support, and online health education center. Again, an excellent service included here in the Ultrio plan membership. And this is a little bit more about the co-pays and the prescription portion of the plan, of the membership, which we discussed. Here's a little bit about the medical advocacy, which we discussed. How does it work? How do you submit a sharing request? It's as simple as 1, 2, 3. If it is an emergency, then just go take care of it. If it's not an emergency, call beforehand. Contact Zion HealthShare, and we'll provide those phone numbers to you. Our medical advocacy team says Zion HealthShare can take you through your healthcare experience and help you navigate it. You're going to present as a self-paying patient, and then you will submit those itemized bills with your password-protected online member portal. So it's very simple, easy as 1, 2, 3. As much as you can help it, call beforehand. If it's an emergency, you don't need to do that. Here are the rates, very reasonable. The way you read these charts is this. If somebody in your family is between this age bracket, then this row applies to you. So if there's a husband who's age 32 and there's a wife who's age 52, well, this is the age bracket that will apply to that husband and wife. And we're talking about member plus spouse here. So this is the price for the $1,000 IUA Ultrio option, $664. Okay. So you can see how to read the chart. You can see that these plans are much more affordable than the alternative in most cases. Additionally, down here, the 5,000 IUA Ultrio option. Example, a family who's got an oldest member between 50 and 64. This would be their monthly price here. Lastly, if you need support, if you have questions, or you just simply like more information, you can contact us at this following number.